Some parents take it for granted when the kids talk too much, ask so many questions, or clown around all day long. We tend to forget how there are some parents that don't get it right away. Due to diverse techniques of detecting autism, we don't have universally acceptable figures regarding the actual number of people suffering from this condition in society. Autism education or sensitivity training can occur in a generalized manner in which students learn about acceptance and sensitivity not related to a particular student at school. It can also be much more specific to the needs of that student and his or her family. Living with someone who has autism can be very challenging. I know how that can be because my little brother has autism. During my speech, I will discuss the causes of autism, symptoms, and treatments. The exact cause of autism syndrome disorder, or ASD, is unknown. The most current research demonstrates that there's no single cause. According to the National Institute of Neurological Disorders and Stroke, both genetics and environment may determine whether a person develops autism. Multiple sources, old and new, have concluded that the disorder isn't caused by vaccines, however. There may not be causes for ASD, but there are many tests to identify it. An ASD diagnosis involves several different screenings, genetic tests, and evaluations. Screening can help with early identification of children who could have ASD. These children may benefit from early diagnosis and intervention. The Modified Checklist for Autism in Toddlers, or known as MCHAT, is a common screening tool used by many pediatric offices. This 23-question survey is filled out by parents. Pediatricians can then use the responses provided to identify children that may be at risk of having autism. There are no cures for autism, but therapies and other treatment considerations can help people feel better or alleviate their symptoms. Massages, weighted blankets and clothing, and meditation techniques may also induce relaxing effects. However, treatment's results will vary. I have with me a weighted blanket. In the autism community, weighted blankets are often used by occupational therapists to help calm or comfort restless or stressed individuals. They're also used to help with the sleep and anxiety issues that are common in people with autism spectrum disorder. Overall, there is no cure for autism. However, there are many other things that you can do to help it. There is no official cause for autism, as it is brought on genetically and environmentally. There is a survey you can fill out to determine if your child has autism. This is not something that can be cured, but there are things you can do to help. The most important thing about having a child with autism is to let them know how loved they are, and that you will always support them and let them know that they are not alone.
Doing applause.